Health officials at the East Municipal Hospital's COVID-19 treatment center in Accra have expressed worry about the increasing symptomatic cases of the infections. Now, it has been confirmed that more COVID-19 positive persons are now being hospitalized because more persons are showing symptoms and falling sick from the virus. Head of our health desk, Fred Smith, has more in the following report.
The country has recorded up to around 300 cases on a daily basis, many of these showing symptoms of the infection, contrary to how the virus has behaved in the past 2 months.
It's important that we continue to maintain the infection prevention control practices, using our face masks, washing our hands frequently, not touching our faces without washing our hands, keeping to the social distance protocols. When we do all these things, we will see fewer and fewer cases. Now, what we realize is more people are getting ill from COVID-19. We used to see a lot more asymptomatic persons in the past, but now we are seeing more symptomatic people now, which is a worry. It shows that more people are staying home till they are really ill before they present to the health facility and are diagnosed with COVID. So again, if you are home and you have a fever, you have a cough, you have difficulty breathing, please don't just stay at home or buy paracetamol from the drugstore. Get to a health facility, get the appropriate clinical diagnosis, and if it's COVID, we can start treatment early so that you can have a full recovery.
JoyNews understands all treatment centers in Accra are now stretched, and some health professionals who've tested positive have been told to go to Cape Coast for treatment. Director General of the Ghana Health Service, Dr. Patrick Abwaje, however, denies this.
Currently, as for the last time, Ghana East has a capacity of 100 beds. As of yesterday, we had about 62 patients there.
But pharmacist and fellow at the Center for Democratic Development, Dr. Kwame Sapong, says he has information to support the report that the country's health systems may be indeed stretched.
We are hearing that more people are coming to hospital with symptoms.
Now, the ranking member on Parliament's Health Committee, Kwabena Mintah-Kando, is worried Ghana's healthcare system will soon become overwhelmed by COVID-19 cases, resulting in dead bodies on the street, as has been seen in other countries. He told the press in Parliament that disclosures by the officials at the Ghana East Treatment Center show that the facility is receiving more cases, evidence the country is losing the fight against COVID-19.
There are emerging signs that the health system will soon be overwhelmed by this pandemic. And I'll give you a typical example. The medical director of the Ghana East Treatment Center has been reported to have stated that the hospital has begun to receive many symptomatic patients as compared to the initial asymptomatic cases, that those who are showing signs of COVID-19 are becoming more than those who are not showing signs. This situation will overwhelm our health system, and mortalities will go beyond the 48 cases. So if you are not very careful, very, very soon, our health system will be overwhelmed as we move to more people showing the symptoms of COVID-19. Government should therefore move beyond lifting of restrictions for political gains and then listen to advice by public health experts on the management of COVID-19 in this country. Looking at the trend, if we are not very careful, at a point in time, we will see more dead bodies in the streets, just like we saw in other countries.